Let's talk about anxiety today. These days, everybody is anxious, somebody more, somebody less, and I would argue that it is unavoidable and somewhat normal, especially if you live in the city like New York City and considering the fact that it is 2024. Your anxiety is not always your enemy. Sometimes it might be that uncomfortable feeling that makes you study more so you make sure that you pass the exam, or that you double check something so you make sure that you don't make a mistake. Or maybe you're just too tense because you're about to break your routine and this forces you to make it to the gym. But if it is intense to the point that it is unbearable, that's limiting your activities and causing impairment, then you have a diagnosable disorder. If anxiety manifests with panic attack, then you have a panic disorder. And panic attack is experience that feels like you are about to die. People describe it as, I feel like I'm having a heart attack, I'm feeling like I'm about to die or choke because I'm short of breath, or I feel like I'm just going to lose my mind and go crazy. So it is next to death experience. And as a consequence, people develop severe limitations in their life and functioning. If panic attacks are happening outdoors, people might develop agoraphobia, fear of open space. And in severe cases, there are people confined to their home because they're too afraid to go outside where panic attack happened. You literally develop fear out of fear, and anxiety about anxiety that your anxiety is going to get worse. Opposite also counts. If you experience panic attack in a confined space, you might develop claustrophobia, not tolerating confined small spaces. If you need to get into the elevator and make it to the 27th floor and you cannot do that, obviously that is significant impairment. If your panic attack happened in a subway and now you cannot actually use subway and get to work, you have a big problem. So this has to be treated. It can be treated with therapy and with medications. Therapy options are cognitive behavioral therapy and exposure therapy, but they take time and they work slowly. Most effective, quickest way to get relief is treatment with medications. And your anxiety disorder usually is going to be treated with two medications. One of them is something from the group of benzodiazepines, medications that treat anxiety and that work immediately. So you immediately get some relief, your panic attacks are controlled, you can stop panic attack that's developing, and you can resume your functioning. But these medications are like a painkiller for pain. They're not treating the underlying reason. What you need to do is to also take an SSRI antidepressant. Now, they're all called antidepressants, but they are first-line treatment for anxiety, and they are prescribed even if you are not depressed at all, and even if you never had depression. Interestingly enough, antidepressants, when used for anxiety, need to be prescribed in a higher dose than when they are prescribed for depression. They tend to work in 4 to 6 weeks. So the idea is that we start both of these medications together. And then the first one is controlling your symptom while the second one is making you better. And then after a while, we kind of wean you off the first one and you only stay on SSRI maintenance, and ideally you are symptom-free. Now, once your symptoms are controlled, you can start living your life normally again, and eventually you get desensitized. So situations, people, places that used to cause fear, anxiety, and panic start being safe. So you're not convicted to necessity of taking this medication for the rest of your life. Actually, after some time, you can be weaned off and you can be fine even without medication. Along the line, you can do cognitive behavioral or exposure therapy. Both is always the best, but if you have to pick one, you do need to pick medication treatment, and very frequently without medication, therapy is simply insufficient to bring you back to being completely well. I hope this is informative and helpful to somebody, and I wish you a wonderful day.